Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today. So today begins the first video in a series I'm going to do in March for Colon Cancer Awareness Month. And these videos are going to be there to hopefully highlight some of the things I want you to know about colon cancer and some of the concerns you may have. Colon cancer is the second leading cause of cancer death in the United States, but is the most preventable cancer that's out there. And I encourage you, if you know anybody who has not had their colonoscopy done, who are of age, over 50 years old with no family history, I would encourage you to contact our office, see if we can get them screened for colon cancer. It is probably the most preventable test that's out there, and it's a very simple way for us to help prevent this disease from progressing any further. Now, in today's talk, I'm going to be discussing colon cancer in younger individuals. So you may be seeing in the news more and more stuff about the rise of colon cancer in younger individuals, the risk for colon cancers, and how we're finding more and more of colon cancer in patients who are less than 50 years old. And it's becoming a scary phenomenon. Within my own clinic, I've diagnosed, unfortunately, a number of patients who were younger than 50 who had just rectal bleeding. We ended up doing a colonoscopy, and they ended up having full-fledged colon cancer. And I want to discuss with you today, whether you may be at risk for developing this particular problem and what you should be looking out for possible signs or symptoms. So colon cancer, like I mentioned before, is the second leading cause of cancer death in the United States, and it is the most preventable cancer that's out there. Now, rates have been decreasing in older individuals because of the more frequent use for colonoscopies. Colonoscopy is a very easy test that allows us to not only diagnose colon cancer, but also prevent precancerous polyps from forming. And colonoscopy has saved lives. The data is very clear on that. The more colonoscopy is within a population, the more prevalent it is within a particular area, the rates of colon cancer has declined subsequently from that. And screening starts at the age of 50 years old, as of this time. At the age of 50 years old, it's when we recommend to get a colonoscopy at least once every 10 years to screen for colon cancer. And with the colonoscopy, we can find these precancerous polyps and remove them before they actually become cancerous. But what we're finding is that there are more and more younger patients, less than 50 years old, who are diagnosed with colon cancer. In fact, there are more recent data to suggest that adults born in 1990 could have twice the risk of colon cancer and 4 times the risk of rectal cancer at the same age than if they've been born in 1950. And so we don't understand why this is happening, but there are more and more individuals who are younger who are developing colon cancer who are being diagnosed with this deadly disease. And the rates of these patients who have colon cancer as they're younger are actually increasing as well. Not only do they have more aggressive disease, but this disease tends to end up being more metastatic and spreading throughout the body. Now, having said all that, I will tell you that the risk for colon cancer in younger individuals is still very low overall. And so I don't want to scare you to say, hey, you need to watch out for that. When you look at the overall picture for people who have colon cancer, the overall risk for younger individuals is still pretty low. However, we do understand that the cancers in younger people versus that cancer in somebody who's older is a different type of cancer. We know that that particular colon cancer tends to be more aggressive, and also there's a higher chance of developing spread of that cancer, or that colon cancer not being limited to just the colon, but metastasizing all throughout the body, which is why some of these patients are unfortunately having a significant disease whenever they are diagnosed with colon cancer. And so the question is why? Why are we seeing more and more cancer in patients who are younger? And why is this cancer more aggressive? And the fact of the matter is no one really understands why this is happening. We think there are some theories that are out there. We think that diet may play a role with respect to colon cancer. And there are some thoughts that this is actually a different type of cancer, completely separate from the normal type of colon cancer that we find in people who are over the age of 50 years old. But by and large, we don't understand why these patients are developing colon cancer at a younger age and why that cancer tends to be more aggressive. Now, the things to watch out for, the things that we worry about, rectal bleeding by far is the most common symptom from colon cancer. But the problem is that rectal bleeding is also a common symptom for a lot of different things, whether it's hemorrhoids, an anal fissure or an anal tear, or anything like that. But the most common symptom that we find in those younger individuals who actually have colon cancer is bleeding thought to be due to a hemorrhoid. This is why I always recommend that bleeding needs to be evaluated by a healthcare professional. You should not blow off bleeding, nor should you just assume that bleeding is only due to hemorrhoids. Now, we'll tell you, in the vast majority of younger individuals, it is hemorrhoids that cause the bleeding. But this is something that should not be avoided or ignored, and something that should have further investigation. But other symptoms include weight loss. You have significant weight loss as well. That's not typical for something that is normal within the body. And so if you have weight loss, you should be concerned about colon cancer. If you have significant diarrhea, this is also a concerning sign for colon cancer as well. And if you have abdominal pain that's very severe in nature, this is also a warning sign of something going on within your body. Now, what to do to help prevent cancer, especially if you're young. Number one is don't ignore the symptoms. If you have symptoms of bleeding, pain, weight loss, don't ignore them. Make sure you seek a healthcare provider to see whether you need to get further investigation going on. And in some individuals, we may have to proceed with a colonoscopy to find out exactly what's going on. And with that colonoscopy, we can see, number one, what could be the cause for your symptoms. Number two, we can remove any precancerous polyps. And number three, if you have anything bad going on there, we can at least know what it is early to start treatment on you very, very quickly. Also, it's important to install healthy eating habits. Well, we do know that people who have a high fat diet, or a diet that's high in red meat, tend to have a higher risk of developing colon disease. And so if you're able to eliminate the fat, eliminate the red meat, eliminate some of the smoked meat, that tends to make it a little bit better chance of not having any long-term GI problems. If you have a family history of colon cancer, if you have somebody in your family who's had colon cancer, especially if it's a first-degree relative, whether it's a brother, a sister, a mother, or a father, you are at high risk of developing colon disease. So it's very important for you to possibly even get screened earlier than the age of 50 years old. I would encourage you to talk to your healthcare provider if you have a family history of colon cancer about whether you need a colonoscopy sooner rather than later. It's also important to exercise daily. Not only is exercise important for your heart, it's also important for your GI tract as well. And it's to make a tremendous amount of improvement in not only making you feel better, but with your overall colon health. And also avoiding excessive alcohol and avoiding smoking. We know these things for sure contribute to a lot of the colon problems a lot of people have. And so if you do have excess alcohol or you do smoke, I would encourage you to do the best that you can to eliminate those to help out with your chance for developing colon cancer. So in summary, we know that colon cancer is occurring in younger individuals. We don't know exactly why that's the case. We do think it may be a combination of diet or maybe even a different disease that's going on. My best advice for you is to not ignore the symptoms. If you have bleeding, if you have abdominal pain, if you have weight loss, make sure you don't ignore those symptoms, because there could be something going on within your GI tract that we need to investigate. And the most important thing you can do to prevent this problem from happening is, number one, see a healthcare provider about some of these symptoms, but also to live a healthy life. And that's very important not only for your colon health, but your overall health as well. So if you are concerned about whether you may have colon cancer, or if you know somebody who is 50 years old who has not had their colonoscopy yet, I would encourage you to get them screened. If you want to visit my website, samirislam.com, or go to this link in particular, if you go on there, you can book online for your colonoscopy, and we can hopefully evaluate you to see if you have colon cancer. Or you can contact our office if that's easier, and here's a number below. And with this, we can schedule your colonoscopy to see if you can get screened and prevent this disease from happening to you.